Hi, everyone. I want to take a brief opportunity to provide a recap of my show, Dr. Guy's Gumbo Talk, that we did where we discussed the impact of depression, bipolar, anxiety, or any mental health issue, those impacts that they can have on a relationship. So on that particular show, we brought in Dr. Malik Rahim, who's a professor and licensed professional counselor, to help join in that discussion. And so the primary goal of that show was to work towards educating, but also trying to decrease the stigma that's still attached to individuals with mental health by discussing it more and hopefully by providing more education so that people don't continue to have these misconceptions about what mental health is or what a diagnosis actually looks like. And so we talked about depression. And depression is so relevant right now during COVID 19. Individuals who have never reported having any symptoms related to depression before are now expressing that they're experiencing those symptoms, and the same goes for things like anxiety. And rightfully so. This is a time where no one has ever experienced anything like what we're experiencing now during this pandemic. And so it has created a lot of emotional concerns for some people. There are others who were already previously diagnosed with a mental health issue like depression, anxiety, or bipolar. And maybe they're seeing some flare ups because of the current situation related with COVID. And so we talked about how these mental health illnesses can show up in a relationship. And one of the things that I really liked about the show is that I brought on Dr. Malik Rahim, and things really do go full circle because Dr. Rahim was actually one of my students years ago when I taught at Chicago State. And teaching at Chicago State for me was full circle because I am originally from Southside Chicago, grew up right down the street um, from Chicago State University. And so it was actually my first teaching position as a professor once I graduated with my doctorate. And so I was really excited to go back to the community that I grew up in to be able to teach at the university there. Well, Malik was one of my students there and definitely an outstanding student. And he's come so far and he's doing so many things. And so I had him on the show, and he talked about the impact of these various diagnoses and how they show up. And so one of the things that I kind of want to highlight is the overview about a diagnosis. So for example, you have what's called clinical depression. And clinical depression is where an individual meets a certain criteria because of the symptoms that they have. So, for example, with depression, in order to be diagnosed with depression, there are 8 criteria. So there are 8 symptom areas that potentially you might present with, but you have to have 5 of those 8, and they have to be present for at least 2 weeks. So one of those symptoms is a loss of interest in things you used to enjoy, but now not so much. Another one is possibly diminished sleep or difficulty sleeping. It could be oversleeping, it could be insomnia. Another symptom might be change in appetite, eating more, eating less. Other symptoms could be related to inability to concentrate and focus, feelings of hopelessness, helplessness, fatigue. There's a change in one's energy level. And then there's obviously the criteria where some might actually have thoughts about self-harm. And so if you are experiencing any of those symptoms, or you know someone who is experiencing any of those symptoms, if they're reporting that they have at least 5 or more, it is a possibility that they could be experiencing depression. And maybe not even know that they have depression. And so how this shows up in a relationship is very different for each person. But there are some general things that seem to be some commonalities that I've noticed in my practice with clients. And that's one, when individuals have depression and their mates, spouses, girlfriends, boyfriends don't know that they have depression, what they do know is that something's different, that this person is off, they're strange, they're not behaving as normal. And the way it shows up in a relationship could be this person is now isolating and they're more withdrawn and they're not talking to you, or they're not talking to anyone, and they want to sleep all day, and things that you guys used to do together in the relationship as a couple, you don't do those anymore, and they can't give you a reason why. They just don't want to do it, or their reason could be they're just tired and they don't have the energy. And so they're telling you all these things that may look like they're pushing their loved ones away, but in reality, it's a symptom of their depression. But the person who they're in a relationship with may not know that. Another way that it may show up is it may show up like aggression. So here's someone who's normally not aggressive verbally, and now maybe they're more irritable. Again, maybe they're speaking louder, but they seem to be more aggressive than they normally are. So it seems out of character for them. So this is maybe something that their mate might be noticing. Another indicator that maybe your mate is experiencing depression is there's a decrease in libido. So they're not interested in sex, and it's not because they're cheating. It's not you, really. They're just not interested. But again, that's tied back to their depression. But if their mates don't know this, then again, it seems as though this is just some unusual, odd behavior that is being present in the relationship that they haven't seen before. So depression can show up very differently for each person, but it definitely has the possibility to impact relationships, because if the person who you're with doesn't know that, for example, you have depression and you now begin to present with these symptoms, what it may look like to that person is that you're trying to push them away, that you're no longer interested in him or her, because you're no longer interested in anything. But because that person doesn't know it, then they internalize that as it's something about them, or that you're just not happy in the relationship versus you're just not happy in general. So for people who might have depression, it's very important for them to be aware of what those symptoms are, because they typically don't experience them all at one time. And so it's a gradual decline for most people. And the first thing is to be aware of what these signs are, what the symptoms are, so that if you are experiencing it, it's a red flag. Okay, maybe if you have seen a therapist before, it's time to go back to your therapist. If you're taking medication, maybe it's time for medication change, or maybe it's time to get back on medication. But it's really important for the person who has been diagnosed to know what their triggers are, so that they can now respond to that and begin to be a little bit proactive. The other reason why it's important to know these symptoms, if you're not the person who's been diagnosed with depression, is because you might see these symptoms in your mate. And because you've seen them in isolation, you don't really put them all together. It's important to begin to notice them, because collectively, it spells out a diagnosis for depression. But individually, it just looks like maybe my mate is no longer interested in me. So I do think that it's helpful for people to know what the symptoms are, and to know that those symptoms have to be present for the majority of the day for at least a minimum of 2 weeks. And obviously it can be longer, but you're looking for at least a minimum of 2 weeks. And because, again, as I said, with COVID-19 and the sheltering in place for a lot of people, or experiencing the loss of work, or even the death of a loved one because of the virus, it could trigger all of those symptoms. And that could be related to the fact that someone is just experiencing grief right now due to the current situation that they're in. Another diagnosis that we talked about on the show was bipolar. And it seems as though people throw the term bipolar around very often. From I'm bipolar because I'm a moody person, Or I'm bipolar because on Monday I'm happy and on Tuesday I feel sad. That's not bipolar. In fact, if that was a criteria for bipolar, we all would have a diagnosis for bipolar. So I think it's important for individuals to know that there are two types of bipolar. There's bipolar 1 and there's bipolar 2. So bipolar 1 is the individual experiences bouts of depression and mania. And so mania is this burst of energy, grandiose attitude. It's being able to go days without potential sleep. It's things are great, I'm on top of the world type of experience. That's mania. Bipolar 2 is very similar, except for the person experiences depression and also what's called hypomania. So in bipolar 1, if you could imagine, the mania is the highest peak. Like this person, as they would say, is on 10. Like they doing the most. And again, they're impulsive, they're going without sleep, and they have a sense of grandiose about themselves. Hypomania in bipolar 2 is, instead of going to the peak with their symptoms, they kind of go right in the middle and then they stop. And so still the same type of symptoms, it's just not maxing out at full-blown mania. And so what you'll typically see with someone who has bipolar 1 or bipolar 2 is that the mania is very short. You're looking at maybe 3 to 4 days where this person experiences mania. And then later, after the mania has ended, it's almost as though they're at this peak, whether it's the mania or the hypomania, and then there's this quick dive for most of them into this depressive state. So they go from, again, I'm on top of the world, I can conquer anything, I'm living my best life, to loss of interest in doing anything, fatigue, no energy, difficulty sleeping or oversleeping, changes in eating habit. Like all of the symptoms that I just mentioned for depression is what this individual now experiences, coming right out of their mania or hypomania. And the unfortunate part is that the depression lasts way longer than the mania and the hypomania. And so if someone is in a relationship with someone who may have bipolar 1 or bipolar 2 in a hypomania or manic state, you might not be aware of what your mate is doing or why they're doing it, because it could be completely out of character. For example, someone might max out all their credit cards in one day on a shopping spree just because they have access to their cards. Or they might go out and impulsively buy a car or sell something valuable, or in some cases marry someone they just met like 2 days ago, or do things that normally they would take time to actually think through. Or if they're not sleeping, sometimes they do things like paint the entire house rainbow colors just because they had energy and they didn't know what else to do with their time. And so this person engages in behavior that would be probably considered bizarre and unusual, but definitely at best described impulsive. And so the person who they're in a relationship with is trying to figure out what just happened, because we didn't talk about any of this and now you're doing things that you normally wouldn't do. And so again, it's important for the person who has bipolar to be aware of what their triggers are or what their red flags are, because if they're in a manic episode, then they're aware that this is my mania. And so maybe if possible, they're able to talk to someone when they're in their manic episode, if they're aware of it, to prevent them from engaging in this impulsive behavior. But in most cases, it doesn't happen that way. They're disconnected from the fact that they're having a manic episode. And so there's more concern with being aware before that happens than when it happens. And then knowing that once the mania or hypomania ends, that the next phase of this diagnosis is depression, right? Like it's not something that is avoidable. So if the person that you know or with has bipolar, oftentimes they will describe this mania and this hypomania as these feelings of euphoria. And so they can get things done, they feel productive. Again, they have this grandiose thinking, and so it's really a high for them. So they don't dislike the mania or the hypomania. But what is always going to follow the mania and the hypomania is going to be a depressive episode. And so that's what becomes the challenge and the difficult part, because depending on how far down they drop in their depressive episode, these individuals might report having thoughts about self-harm, and sometimes they might even make suicide attempts. And so if they're with someone in a relationship, married, dating, and this person does not know that they have bipolar and these behaviors occur, it seems very unusual and strange. And so the loved one is completely confused because the person who they married or they've been dating hasn't exhibited any of this behavior ever before, and now they're seeing it for the first time. And so to see the switch, and for the most part a matter of a week, to these high to this very low depressive state doesn't seem normal to the person that they're in a relationship with. And so that's very confusing for them. And in most cases, individuals who have bipolar will take medications to help manage those manic episodes and depressive episodes. It's also the recommendation for them to be in therapy as well. It's the combination of the two that's really most effective for individuals with bipolar. But in relationships, again, it shows up possibly as the person who was in a manic episode has an affair during their mania. And it's typically probably not something that they would do if they were not in a manic episode, but because this is a time of impulsivity and grandiose thinking, this behavior has taken place. And so obviously you can see how that would impact someone in a relationship if they're finding out that their mate is cheating on them, and maybe with multiple people within that manic time frame. So if it's in a week, 3 or 4 days, it could be multiple partners and not just one. So that greatly impacts the relationship. And after that, what I often hear in sessions with my clients is that they have this intense amount of guilt and shame attached to their behavior during a manic episode, and then their mates or spouses are obviously impacted emotionally by their behaviors. And so now you have this snowball effect, because the manic episode triggered this impulsive behavior, and as a result of the manic episode, the person they're in a relationship with is angry and hurt because of that behavior, and not really understanding why that behavior took place, because it was so out of character and so random at the particular time. Now they're having a difficult time of forgiving the person that they're in a relationship with, because they don't know that they have bipolar or that they've been diagnosed with bipolar. And so this happens very often when I see clients in the session, is that either one, they didn't know that they had bipolar, and they've had these manic and depressive episodes for years and just didn't get help because they didn't know that it was a diagnosis, or they have bipolar and they're afraid to tell their mate that they have bipolar because they think he or she will leave the relationship or won't want to be with them anymore because they have bipolar. So they keep it a secret as long as possible, obviously, until they have that first manic episode. So that greatly diminishes the relationship or the trust that the two parties have, because they either chose not to share, or in some cases they just didn't know that they had bipolar themselves. The other one that we talked about on the show was anxiety. And oftentimes clients, if I ask the question about asking them to rate their anxiety on a scale from 1 to 10, sometimes they'll say, I don't really know what anxiety is. Like, I need you to describe it for me. Like, they know what it means to be anxious, but in comparison to their lives, they're just like, what do you mean? And so I describe anxiety as a sense of overwhelming concern and worry. And it's not the worry that says, oh, I'm worried. Let's say it's a horrible thunderstorm and your loved one is out driving. You might be a little worried, but not to the point to where you can't sleep at night, because for the most part you're pretty confident in their skills of driving. But it's the type of worry that prevents you from sleeping in some cases. It's the type of worry that prevents individuals from making decisions. It blocks one's inability to concentrate and to focus. And so the worry begins to impede on other functions that they need to take care of, but it prevents them from doing that. And in some cases, the excessive worrying can present itself in the form of panic attack. And so anyone who's ever had a panic attack knows that it feels like a heart attack. Most often clients will say they felt like they were dying. They were like gasping for air. Their chest hurt, and it caused them to actually go to the ER. And once they were evaluated and seen, doctors said, physically you're all fine, but looks like it was a panic attack. So that's what happens in severe cases where the worrying has become so overbearing that it now presents itself in the form of these panic attacks. And the panic attacks feel, again, like most cases, heart attacks. But for the client to be able to deal with that scenario, it's understanding that, one, you're not dying, you're not having a heart attack, but your brain is telling you that you are, which triggers all the other emotional and physical responses as though you were actually having those symptoms in actuality. So when that happens in a relationship and the partner doesn't know about it, again, it's a scary feeling for that person, because now they think that their loved one, mate or spouse, is dying, that they're literally having a heart attack, because they present with these symptoms only to find out that it's not a heart attack, it's their anxiety. But again, they might not have known that their loved one had anxiety, and definitely they didn't know that they were having panic attacks. So doesn't matter what the diagnosis is, bipolar, depression, anxiety, it could be schizophrenia even. Any of these mental health illnesses greatly impact relationships, especially when the person who has the diagnosis doesn't tell the person who they're in a relationship with. And I think that's one of the things that I hear in my sessions that is so damaging, because the person who they're in a relationship with, whether it's a 6-month relationship or they've been together 10 years, if this person does not know about the diagnosis, then they are not fully prepared to be in a relationship with the individual who has the diagnosis. Because regardless if they believe that it carries a stigma or whatever they think that person is going to feel or believe about them, they're going to need that person as a support system. Because when they have these occurrences, whether it's a manic episode or suicidal ideations or panic attacks, if the person who they're in a relationship with has no clue that their loved one has a mental health disorder, one, it puts that person in a state of fear, concern. It leaves them feeling debilitated because they don't know what to do. And they didn't expect it, they didn't know it was coming, and now that it's here, they have no idea how to respond to it. And so it puts that person in a disadvantage. So it's really important, if someone is in a relationship and they have a mental health diagnosis, it's important to include the person who you're in a relationship with into that process. Because one, you do need them as a support system. Number two, sometimes they're able to see your red flags before you can see those red flags. And so this person can help you become more proactive instead of reacting to something that may leave you in a state of, again, impulsivity and making these bad decisions, or in extreme cases, it could lead to someone having a suicidal attempt or suicide attempt. So I would hope that for someone who might have a mental health diagnosis, that you trust your relationship enough to trust that person with the truth, and to know that it's okay if you have a diagnosis. It doesn't change who you are. It just means that you have to do things differently in some cases than someone else. It also may mean that you have to be more aware of what your triggers are. But other than that, it just means you have a diagnosis. It's no different than someone who has been diagnosed with diabetes. That individual has to watch what they eat. Right? They can't eat what everyone else is eating when they're eating, even though they want to. But if they want to live a healthy life, then they have to avoid that. But for them, their loved ones most likely are going to know that, because they're going to want that person to be around longer. So they're not going to say, hey, let's go out and eat this food that I know you can't eat. Well, that doesn't make sense. If I know you're diabetic, then you shouldn't be eating this, then I shouldn't be trying to feed you this. Well, it's no different when we're talking about someone who has a mental health issue. The person who they have decided to have in their life as a spouse or a girlfriend or a boyfriend really should also be there to support them in that process of dealing with their mental health illness, because it is a lifestyle. It would be great to say that if you have bipolar, once you get treatment the first time, it will never come back. Not true. Unfortunately, having bipolar means you do have that diagnosis, that you will have these manic episodes, you will have the depressive states, unless you treat those symptoms, which means being in therapy and also in some cases taking medication. There are other ways that people treat bipolar. Sometimes they use herbal remedies, and again, talk therapy. Great. Not saying that those things are not effective. They are. But what's ineffective is the person who believes that I have a diagnosis and I don't have to do anything with it. I don't have to take medication. I don't have to do therapy. I don't have to do anything. That is false. Your symptoms will not just automatically disappear. They just won't go away on their own. They're going to be present until you manage them or treat the symptoms. And the same is for depression, the same is for anxiety. And so it is very important to know that the people that you have decided to keep in your life should also know about your diagnosis. And know that just because you have one or two of maybe the symptoms that I've mentioned doesn't mean that you have the diagnosis. You could have two of the symptoms that I mentioned, fatigue and loss of interest in things you used to enjoy. That doesn't mean that you would be diagnosed as depression. We have two. Remember, in order to have a diagnosis, you have to meet a specific number of criteria, and it has to be present for a number of weeks, whether it's bipolar, depression, anxiety, whatever the diagnosis is. And the only way to truly find out is to see a clinician, whether it is a psychiatrist, a psychologist, a licensed counselor, a licensed social worker, someone who can do an evaluation and properly assess you. That is really the only way to determine if someone has any diagnosis, is to have them properly assessed. Oftentimes clients will come into the office and say, oh, I know I have this diagnosis. And then I'll ask them, well, who diagnosed you? And they'll say, I diagnosed myself. That's so nice. But no, don't diagnose yourself. Seek out professional help if you think that you have any of those symptoms, or if you think that the person you with has any of those symptoms or potentially might have another mental health issue. Seek out professional help. There's treatment. Doesn't mean that these things and symptoms will go away, but they are manageable, and they can greatly impact and damage relationships, in some cases beyond repair. So I think the best thing to do is to seek out professional help. and then to move forward in the relationship, not only with a person in therapy who has the diagnosis, but it is really helpful when their loved one is also brought into those sessions, because again, they're the best support system that that person has at that particular time. So I want to thank Dr. Malik Rahim for joining me that Sunday when we talked about how these diagnoses impact relationships, because the conversation was really, I think, informative. If you haven't had an opportunity to listen to the whole show, it has been posted. So make sure you take an opportunity to listen to the show. I definitely think there was some information that might be beneficial to someone who could be in a relationship with someone with a mental health diagnosis, or it could be you. With that being said, you guys, I gotta go. Make sure you all continue to be safe. And don't forget to subscribe to my channel. Thanks.